You have one more measure, item number 13, AB 2319, California Dignity in Pregnancy and Childbirth Act. No rush. Please proceed when you're ready, though.
Thank you. All righty. Good afternoon. Again, I would like to begin by accepting the committee amendments to modify the enforcement provisions and thank the chair and committee staff for working with my office and the sponsors on this bill. I'm pleased to present AB 2319, which aims to reduce the alarming and disproportionate maternal mortality rate of Black women and other pregnant persons of color by ensuring successful implementation of SB 464, by Mitchell and the California Dignity and Pregnancy and Childbirth of 2019 Act. A recent study by the California Department of Public Health, also known as CDPH, found that women of color, in particular Black women, die of pregnancy-related complications at much higher rates than white women in California. This disparity exists across all income levels. Now, to address this, the California State Legislature passed the act in 2019, which requires hospitals, alternative birth centers, and primary care clinics, which are the facilities covered under the Act, to conduct evidence-based implicit bias training for all health professionals who provide care during a person's pregnancy, childbirth, and immediate postpartum period. In August 2021, the Department of Justice, also known as DOJ, launched an investigation to ascertain compliance with the Act. While some facilities went above and beyond the requirements of the Act, there is still more work to be done to ensure full compliance. DOJ's investigation revealed that there is a need for an enforcement mechanism, public transparency of compliance data, firm compliance deadlines, and additional specificity and clarity so that facilities are better equipped to know which providers need to be trained, and AB 2319 accomplishes this. I am a mother and a grandmother. I have sisters, aunts, nieces, and friends that look just like me. As a Black woman, these statistics hit way too close to home. They acknowledge the sobering reality of being a pregnant woman of color in this state and highlights the need to correct the course we're on. Now, with me today to testify in support is Tiffany Matthews with the Attorney General's Office and Kim Chiaji. Say it again. Cuevas, sorry, a professional and community doula with Black Women for Wellness Action Project to speak more on the importance of AB 2319 and to answer any questions that you may have.
Welcome. Thank you for joining us. Please identify yourselves for the record when you begin to speak, and I'll let you choose who goes first. Yes, ma'am. Looks like it's you.
I'll jump in. Thank you. Hi. Tiffany Brokaw. My last name recently changed. But anyway.
Congratulations.
Thank you. Good afternoon, Chair and members. Tiffany Brokaw, Deputy Attorney General and Legislative Advocate at the California Department of Justice. And I'm here today on behalf of Attorney General Rob Bonta, who is one of the proud co-sponsors of this bill, along with Black Women for Wellness Action Project, Reproductive Freedom for All, Western Center on Law and Poverty, the California Nurse Midwives Association, and Black Women's Collective. We'd like to thank the author, Assemblymember Wilson, and Dr. Weber for their leadership on this, and the rest of the California Legislative Black Caucus for making this bill a priority, and the Women's Caucus as well. So the United States has the highest maternal mortality rate in the developed world. And in California, people of color, particularly Black women, continue to die at 3 to 4 times the rate of white women. AB 2319 aims to reduce the alarming and disproportionate maternal mortality rate by ensuring successful implementation of the California Dignity in Pregnancy and Childbirth Act, which was authored by then Senator Holly Mitchell in 2019. So the Act requires healthcare facilities to conduct evidence-based implicit bias trainings for all health professionals who provide care during a patient's pregnancy, childbirth, and immediate postpartum period. So it's one thing for a law to get passed, but it's another to make sure that it's implemented. So in August of 2021, DOJ launched an investigation to ascertain compliance with the Act. And once DOJ began its investigation, whereby they sent letters to all covered facilities to see what efforts were being made to comply with the Act, based on information that was provided to them by responding facilities, they found that about 17% of facilities had begun complying with the act, and not one employee had been fully trained. And by the end of the investigation, about 81% of providers had been fully trained. So the whole goal of this is to just close that gap and make sure that 100% of the providers covered in the act are being trained, because the goal here is to reduce bias in our healthcare system. So to better equip health facilities to comply with the Act and administer these required anti-bias trainings, AB 2319 will provide clarity on which facilities are mandated to administer these trainings and which providers need to be trained. It will establish firm deadlines by which trainings must be completed to better guide compliance. It will also confer enforcement powers upon the DOJ, and it will authorize the DOJ to post compliance data online so that the public can see which facilities did or did not administer these trainings. And for these reasons, we respectfully ask for an aye vote.
Thank you. Next, please.
Greetings, Senator Roth and esteemed Health Committee members. My name is Kairos Chiaji. I'm a veteran doula of 25 years of nonstop practice, which kind of makes me a unicorn in this field. I train doulas in the community, and I'm a founder of Children of the Sun Doula Project, a nonprofit dedicated to increasing the community-based birth support workforce. I've seen lots of changes in 25 years of birth work. I've seen the modernization of medical facilities. I've seen the medications offered in medical management of labor and birth change. I've even seen the quality of the food served in the hospital cafeterias improve. The one thing that hasn't changed is the impact of bias on medically responsive care. Because I have served so many of the families representing the incredibly diverse population in this region, I have had a front row seat in the differences between care of BIPOC families and white presenting families when bias is unrecognized and unchecked are demoralizing. Let me share a few brief stories. There was a birth with a young mom and dad having their first baby, and they were attending an OB who had quite some time in the field, and he made it very clear that he preferred to be at a different birth. So much so that when the second birth was progressing more quickly than the one that he was attending, he left in the middle of the birth with his resident's hand inside of the mom, holding an incision that he had created to rush her through delivering the baby and not finish suturing. That's one story. Another couple having their second baby, professional, middle class people very excited on this opportunity to have a baby. In one of their regular scans during their care, it was discovered that mom's body might be opening a little early for this baby. This happens often, and there is a regular common procedure that happens to help mom's body stay closed so baby can stay inside. Somehow during this procedure, there was a catastrophic error, and only halfway through the pregnancy, her water bag was ruptured. She was brought back to her room, left in the hospital room all night, by herself with only her husband, no monitoring, no care, leaking fluid, not even knowing if her baby was still alive. The next morning, they are on the phone with me, and the nurse that comes in, the first thing she says is, "We don't do terminations of pregnancy here," and basically said, "Go home." It took a lot of advocacy to get some care. The care finally happened, but at this point, there was an infection that occurred from the procedure, and 2 days later, their baby was born and passed away. The last story, a mom married having a history of some miscarriages, which in her own research she discovered were preventable had there been proactive care. When the pregnancy that she was experiencing got to the second trimester, the baby passed away. She reached out for care that made sense for her body to her providers. checking multiple providers, multiple facilities. She reached out to support of a birth professional, and I went with her to these appointments where multiple times people came in not even having read her chart. Hey, what are you here for today? Where she had to say repeatedly, my baby died. It took 5 months. 5 months of carrying her deceased baby inside of her body to finally get care that could resolve what they call a miscarriage so that she could move on with her physical health and begin the process of grieving her baby. And even at that point of care, all I did was go to the car to drive her home because her husband was home with the other children. And in the course of that, they gave her some sort of antibiotic where she had a poor reaction to it. When I called and asked some questions just about how she was doing, the nurse snapped at me. So I came back in to wait. They tried to send me out again, and I refused because I said the last time I left, she crashed. I'm not going to do that. I'm going to wait here. We got her home, and she's okay. But all of these things are not because there was a person who was uncompliant with their care, not because they were undeserving, not because, any of the things that somebody might say, well, this was inevitable. They weren't. They were preventable. So that's the testimony I'm offering, and I'm tremendously grateful to Assemblymember Wilson for presenting this bill and offering the opportunity to speak on an issue that I'm so passionate about, and I hope you lean heavily into the idea of accepting, supporting, and ultimately passing this bill, because no matter what else happens in a child's life, their first ACE shouldn't be the day they were born. AB 2319 is one way to protect them from it. Thank you.
Thank you for joining us today and for providing your testimony. You do have a great author, by the way. Any other witnesses in support? Name, affiliation, and position on the measure, please.
Good afternoon, Chair and members. Sandra Poole, Western Center on Law and Poverty, proud co-sponsor and support.
Craig Pulser on behalf of Equality California in support.
Nicole Wortelman on behalf of the Children's Partnership in support.
Hello, Genesis Gonzalez on behalf of Lieutenant Governor Eleni Kounalakis in support. Thank you.
Martin Radosevich on behalf of Reproductive Freedom for All California and the California Nurse Midwives Association, proud co-sponsors. Thank you.
Thank you.
Good afternoon, Chair and members. Jonathan Munoz on behalf of First Live California and First Live LA in strong support, and we thank the author for her leadership on this.
Thank you. Next, please.
Jennifer Robles with Health Access California in support.
Thank you.
Donna Wood with the California Coalition of the National Council of Negro Women. I speak on behalf of more than 4,000 women in support of AB 2319.
Thank you for joining us. Next, please.
Katrina Dunn, California Black Health Network in support.
Thank you.
Kelly Brooks on behalf of the Santa Clara County Board of Supervisors here in support.
Thank you.
Nora Lynn with Children Now in support.
Thank you.
Lan Lei on behalf of Asian Americans Advancing Justice Southern California in strong support.
Thank you, ma'am. Next, please.
Beth Monowski, the SEIU California in support.
Thank you.
Kelly Macmillan on behalf of the California Commission on the Status of Women and Girls and March of Dimes in support.
Thank you. Sir?
Dylan Elliott on behalf of the California State Association of Psychiatrists and the San Francisco Board of Supervisors, both in support. Thank you.
Next.
George Bramthew on behalf of ACLU California Action in support. Thank you.
Vanessa Kahina on behalf of the California Pan-Ethnic Health Network here in support.
Thank you.
Kathy Mosper with First Five Association in support, along with Essential Access Health and AIDS Project Los Angeles. Thank you.
Thank you. Thanks for coming. Any other witnesses in support? Let's turn to witnesses in opposition. First, lead witnesses in opposition, if any, or any others. Sir, join us at the table. Please identify yourself for the record. Proceed when ready. Try it.
How about now?
Perfect.
Right.
Chair members, my name is Greg Burt, and I am representing the California Family Council as the Vice President, here to voice our opposition to AB 2319. Our concerns relate to the transgender implicit bias training this bill requires, which hasn't really been brought up. This bill fundamentally misconstrues the concept of implicit bias and imposes damaging consequences on medical professionals for adhering to biological truths. It is not implicit bias to believe that only females can give birth. This is a biological fact consistently observed and confirmed by science. This bill penalizes medical professionals for recognizing such fundamental truths. It undermines the integrity of the medical practice and risks patient care by forcing professionals to deny biological realities. Furthermore, AB 2319 uses political pressure and even shame to compel medical staff to give up their scientific and personal religious beliefs about male and female bodies. Sadly, this reminds me of the techniques used by the Red Guard during the Cultural Revolution in Communist China, where its citizens were forced to go through re-education to get rid of the four olds, as they called them: old ideas, old culture, old customs, and old habits. And lastly, recognizing motherhood as a biologically based upholds the dignity of women. Motherhood is a unique aspect of female biology, and acknowledging this fact respects and celebrates the role of women in society. Denying the biological basis of motherhood diminishes the special contributions of women and erodes the foundational understanding of family and community. And for these reasons, we urge you to oppose AB 2319. Thank you so much.
Thank you, sir. Thanks for joining us. Any other witnesses in opposition? Seeing none, let's bring the matter back to the dais. Colleagues, any questions, comments, concerns?
I just want to thank the author for bringing this forward and thank the witnesses for sharing, particularly our doula from Black Women for Wellness in my district. I just want to say what an education you shared with us in terms of what women are facing. And this is a small step. Compliance is a small step toward addressing the evils of institutionalized racism that prevent our most important, precious beings from coming into the world. So I just want to say thank you for your courage, for sharing the story, and I'm happy to move the bill when the time is right.
Thank you, Senator Smallwood-Cuevas. Seeing no other questions, comments, or concerns, Assemblymember, great job. You may close.
Thank you, Mr. Chair. I appreciate the comments from my colleague as a part of the California Legislative Black Caucus, who is also a co-author on this bill. And as it was noted, it was a priority. I thank Deputy AG Brokaw and Doula Chiaji for your testimony. And as it was stated, very enlightening. And just to clear up, and my close, just to clear up any misinformation around this bill, as it was noted by the opposing testimony, is the enforcement mechanism related to this bill is truly related to whether or not these entities have completed their implicit bias program. This bill does nothing to erase motherhood, to erase women. It is an expanding bill, an inclusionary bill, to ensure that anyone who is giving birth, whether they are non-binary, whether they transgender, it doesn't matter. The requirement is to remove implicit bias against anyone who has a womb and coming in to receive care. Because whether you identify as a woman, identify as non-binary, identify as transgender, you should be able to come in, receive quality care, and both you and your baby be able to be delivered safely. And if there is an issue with the baby being able to be delivered safely, that you as a person, no matter who you are, also come out of it successfully. And that is the intention of this bill, is to protect those people with wombs, to ensure that they are cared for properly when they receive care without bias. When appropriate, I ask for your I vote, and I thank you and appreciate all that's went in to make this bill, bring this bill to where it is today.
Thank you. As soon as we achieve a quorum, we'll take a motion and we'll do just that. Thank you for your presentation. Thank you for joining us today.